Hi, my name's Kim, and I'm a specialized Chinese medical provider and Taoist practitioner. And this channel is all about you, sharing with you information and solutions from the ancient Chinese medical cabinet of healing remedies and helping you figure out how to use them in your everyday life. And today I wanted to talk about chemotherapy-induced neuropathy. I've had many clients over the years who've had neuropathy, and the majority of the clients have had either chemotherapy or diabetic-induced neuropathy. And the techniques that I'm going to show you today, you can use for a lot of different types of neuropathy. These techniques are not limited to chemotherapy-induced neuropathy. And some of these techniques are going to work just fine on other types of neuropathy, yet there's many different reasons why you have neuropathy. And let's say, for instance, you have neuropathy due to a compressed nerve in your neck or your low back, then these techniques are not going to work for that. Although I've had many clients with chemotherapy-induced neuropathy, it really hit home for me with my sister's cancer. It's a totally different thing when someone you love is facing this disease. You get to see a whole different side of the disease. And I was able to see how chemotherapy just exhausted her. I was able to see how chemotherapy impacted her brain function and her ability to problem solve. And I was able to see how difficult it was for her to prioritize things in her life because suddenly everything was important. So this is for my sister. And I've put everything you need to know in a simple vlog. And I've even marked all the chapters so you don't have to go through the whole video again to pick out that one section that you need to look at to remember. You can go directly to that section. And I know that even watching this vlog can be taxing and overwhelming, but if you need to see me again, here I am. Anyone on chemotherapy has felt the heat of chemo as it moves into and around your body. And in Chinese medicine, they identify 8 influences that can impact your health, and heat is one of them. Too much heat on a sunny day can cause sunstroke, and too much hot food can cause heartburn, indigestion, or diarrhea. So too much heat cooking food can burn the food. The idea is too much of anything causes negative impacts. Well, heat has other impacts on the body, and I grew up in Minnesota, the land of 10,000 lakes, and there were these little lakes and ponds all over the state, and some of them were just glorified puddles that would come back every year. And in the spring, this vibrant puddle full of life and sounds would emerge from the snow. And then as spring moved into summer, the heat would begin to dry up the puddle. For some reason, when the ground was no longer frozen, even the rains couldn't drop enough water to keep these puddles fresh. So by midsummer, the heat had evaporated most of these puddles, and for those that were left, they were more like a stinky pot of goo that would dry up entirely before the summer ended. Too much heat in the body is similar. We need yin in the body for sleep, memory, flexibility, and a host of other things. And chemotherapy is considered drying in its nature. And in Chinese medicine, they say that the excess heat from chemotherapy dries out the tendons and ligaments, which causes the neuropathy. Your skin gets drier. Your feet may get dry, rough, and cracked. You might have difficulty sleeping, you're feeling exhausted, you get nauseated. And when your fingers and toes start to feel the numbness, tingling, and pain, you might try to move them and notice that they feel stiffer and they don't have the same flexibility. And that is what they consider that drying nature in chemotherapy. The cause is excess heat and drying of the tissues, and the treatment would be twofold. First would be to reduce the pain, tingling, and numbness. And second, to put moisture back in the body and reduce the heat. Let's talk about 3 things you can do at home to help manage your neuropathy. So first, to reduce the pain, tingling, and numbness, you're going to want more blood to flow to your toes and fingers. You want your blood to flow like it used to flow before you had chemotherapy. And one way to improve flow is with moxa. And I swear, moxa is the craziest herb in the Chinese pharmacy. It helps with 1,000 different diseases. And being that you're using smokeless moxa sticks, you can even use them indoors. So let's say your favorite place has become the couch. Well, sit up, grab your moxa stick, light it up, and go over your hands and feet for the next 10 to 15 minutes. You know, you probably weren't going to be moving for the next 1 to 2 hours, and you might be sitting there all day. Let me show you where I like to use the moxa stick. On the hands, run it over the knuckles on the back of the hand, and there are acupuncture points between each knuckle that I would use in clinic to treat this type of neuropathy. And even though you can use moxa on the palm side of the hand beneath the knuckles, I think the back of the hand is more effective. On the feet, run the moxa stick over the foot where the toes meet the foot. And there are points here that I would use to treat neuropathy in clinic. And you can use moxa on the sole of the foot, right underneath the toes. And I think that would be effective also. It's harder to reach. You know, sometimes just reaching our toes is difficult. So sit up, cross your leg, and do 1 foot at a time. Working to stay in front of your neuropathy by doing this a couple times a day can really help. And the second thing I strongly encourage is the use of foot massagers. And I haven't found a good one for hands, but there are a lot of foot massagers on the market for your feet. And so pick one of those up, put it where you like to sit, and maybe it's a couch. So after you're done doing your moxa, pull your foot massager out and put your feet on it and let them sit there for a few minutes. Okay, some of you know that I'm into horses. Well, for those of you who know horse people think like, well, if it's good for my horse, it's got to be good for me. Or it worked on my horse. Or my horse likes it. You know, we think that because it worked on our horse, there is a correlation to how it's going to work on us. And it's almost like we believe we have completed some sort of scientific research that proves the efficacy of treatment in humans. Whatever. And, you know, that's what it is. So when you walk into a horse person's tack room, you've just walked into their pharmacy. And this next one comes straight from my tack room to you. So there's this product that's used on racehorses when a horse has injured a leg tendon, and the product comes from a company called Back on Track. And their products were known like the Back on Track leg wraps or the Back on Track hock wraps. And they were really effective products that, since they worked for horse injuries, riders started using them on their own injuries. So Back on Track started making their products for people. Now, I don't really understand their technology or what they're doing. The technology seems to keep warmth in the area suffering injury, and the company has gloves that I've recommended to my massage and dental hygienists for their hand arthritis, and they've had great results from them. And the company has socks, which I use, and anyone who has ridden horses their whole life knows riders have feet problems. So there are 3 things you can do to help with your neuropathy. Have you noticed you've been craving watermelon or cucumbers? It's impressive, but we know what's right for us. Both watermelon and cucumbers cool the heat and help rebuild the yin in the body. And here's another food you might not be familiar with, and that's mung beans. And I can't find mung beans in every grocery store. They look just like lentils, like green lentils, but I can find them in about half the stores. Mung beans can be soaked and cooked like any other bean. You can slow cook them overnight and just add in onions, carrots, garlic, or anything else that you usually add to your beans, slow cook them overnight and eat them. And mung beans are really, really cooling. So they're going to work really, really fast on heartburn and acid indigestion. And in general, if you eat any of these foods that I'm mentioning here and your acid indigestion goes up, then your stomach's cold. And don't eat any of these foods. You're going to have to eat different foods, okay? With chemotherapy, your appetite isn't going to be good. So grains like barley or basmati rice really help strengthen the stomach and reduce the nausea. They also help rebuild yin. The more you rebuild your yin, the more improvement you're going to see in your neuropathy. Okay, so there's a truckload of stuff for you to sift through. And until next time, I'll catch you on the other side.